Hello, so today we will be discussing about Pagets disease of bone. So most of the patients will be asymptomatic, but sometimes there will be symptoms. So these are the symptoms here. So we can see that there's a huge, giant woman who is on a bicycle. So you can see that she's holding her head. So she's presenting with headache, and you can see that I've drawn bigger ears so she can have hearing loss, and I've drawn a hat here. So just to give a brief description, in Paget's disease, the pathophysiology is basically excessive bone remodeling due to increased osteoclastic as well as osteoblastic activity, and that is why it replaces the strong lamellar bone with weak disorganized woven bone, and it's going to affect the skull, the spine, the femur, and the tibia, and that's why you're getting all these presentations. And the classic, one more classic sign, or this one more classic presentation is they tell you that my hat size is increased. Okay, so this is why I've drawn a hat. Now you can see that she is bending, and we know that when a patient has spinal stenosis they will bend, that which is the cartwheel sign, right? So that's why this is spinal stenosis. They can present with spinal stenosis, and she has normal bone pain. She's pretty sad. So sad sarcoma, osteosarcoma. So it is very important association, osteosarcoma and Paget's disease. And since she's very giant cell tumor is also another important association. Okay, and then we can see that she can have arthritis. There can be bowing of the long bones, or there can be fractures. Okay, and we can see that there can be radiculopathy as well, and she's on a bicycle. That's why the treatment is going to be bisphosphonates. And I have told you for the labs, I've told you it's a normal day. So what are the things that are normal in case of Paget's disease? So the calcium levels will be normal, the phosphate levels will be normal, but only one thing will be elevated, which is the ALP, because the problem is that there is increased bone cell turnover. So how I remember it is, except for ALP, everything else is normal. Okay, so ALP is elevated, so isolated ALP elevation is seen in Paget's disease. And also remember, because there's increased bone cell turnover, they can tell you that you can see increased PINP. Okay, in the you can see increased PINP. PINP is nothing as pro collagen type 1 N terminal propeptidase, which I don't think so you need to remember, but remember that can be elevated. And they can tell you that randomly they can just throw a fact that urine hydroxyproline is also elevated. They're just trying to tell you that there is increased bone cell turnover. And X-ray, I think, is very important to remember. You can have osteolytic, or you can have mixed, or you can have sclerotic, right? And if at all they throw a random fact about bone scan, remember there is increased uptake.